This series was developed in collaboration with TDR Global. TDR Global is a worldwide community of passionate scientists and experts who have been working with TDR on research on infectious diseases of poverty. Some of their current global engagement efforts include the recent crowdsourcing contest with SESH, which engage researchers and educators in low and middle income countries to generate practical ideas to improve research mentorship at the organizational level. If interested in learning more, please visit their website for publications of their findings from this contest. Welcome to your Digital Mentor podcast. I'm your host, Emmanuel Opon, coming to you from Manchester City. In this episode, we'll be connecting with the winners of the TDR Global 2020 Career Impact Contest. TDR is a community of passionate scientists and experts who work to support the global research effort on infectious diseases of poverty. And this contest sought to highlight how the support of TDR had made an impact on the careers of scientists, such as our winners, whom we'll be talking with in a few minutes, and their work in addressing infectious diseases of poverty. So we'll be delving into their stories, their work, their research, and its connections to mentoring, as well as the impacts they've had. Hopefully, through our discussions, we can take away some lessons, advice, or tips we can utilize and apply in our own work and research in our mentoring relationships. Joining us today, we have Dr. Nadira Kurunaweera, and she's the Chair Professor of Parasitology, Faculty of Medicine at the University of Colombo, and a Visiting Fellow at the School of Public Health, Harvard University. As a medical parasitologist, she has extensive teaching, training, and research experience in tropical diseases, especially vector-borne diseases. Her achievements have been recognized through many awards, honors, and fellowships. We also have with us today Dr. Avila Montes. He's an ex-TDR guarantee with public health experience in Honduras, El Salvador, Puerto Rico, and Guatemala, and an effective manager in program design, management, strategic planning, and health research related to vector-borne diseases control, such as dengue, Zika, Chagas disease, as well as outbreak response, maternal and child health, and HIV and AIDS control. And finally, we have with us Dr. Rashad Abdul-Ghani. He's an associate professor and researcher at the Faculty of Medicine and Health Sciences, Sana University, and the Tropical Disease Research Center, University of Science and Technology. His research focuses on parasitic diseases, neglected tropical diseases, vector-borne diseases, and public health. It's nice to have you all here with us today. So we are going to delve in, but before we do that, based on the stories that were shared about the Career Impact Contest, I know that, for example, Gustavo, you have worked on diseases related to vector-borne diseases, so diseases connected to the vectors, epidemiology, outbreak investigation, as well as disease control and prevention with the Pan-American organization. And Nadira, you've done research utilizing genomics to understand the pathogenesis of vector-borne diseases like malaria and leishmaniasis. And Dr. Rashad, you've also done research on vector-borne diseases and their transmission, including with other countries that face similar challenges. So these are all work you've done, but for today, I wanted to ask, what are you working on now? Because you've done so much, but at the moment, what projects are you working on? If maybe we could start with Gustavo.
Good morning, everybody. It's a nice pleasure to be here this morning. Currently, I am linked to the Universidad del Valle de Guatemala, directing a regional HIV prevention project at the level of the Central American region, which is financed by the PEPFAR initiative through the CDC, Center for Disease Control. Through this project, we support the Ministry of Health of Guatemala, El Salvador, Honduras, Nicaragua, and Panama to improve access to health services for key population with a view to contributing to the objective set by UNAIDS to eliminate HIV/AIDS by the year 2030. Also, I am part of the Research Bioethics Committee of the Universidad del Valle de Guatemala, where we are contributing to the review of research proposal and advising field epidemiology master students in their thesis work related to the area of the HIV prevention and control. Additionally, I am resuming some manuscripts that I have been pending and that I hope to submit for publication this year. One of them has to do with the development of educational courses at the school level for the control of Aedes aegypti. in this field, we have several papers that show the usefulness of school program to promote community participation in the control of Aedes aegypti, dengue, and arboviruses in general, continue to be an important public health problem, and the control of Aedes aegypti represent a challenge due to the structural, social, and behavioral factor that must be taken into account for a comprehensive approach to the problem.
Thank you, Gustavo. You have a lot going on. I can't wait to learn more about it, whether it's with your students or your transcripts and different projects you're working on across the Latin American region. What about you, Nadira?
Thanks, Ella. It's good to be here. My current work mostly involves the vector-borne disease leishmaniasis, which is considered as a neglected tropical disease. And we have a fairly big team working in this area. We look at the parasite, host aspects, as well as there are studies going on the vector. So there are a lot of laboratory work as well as field studies that are being conducted across Sri Lanka. And we also have a field site in Bhutan. So it's a collaborative project. So there's a team in Bhutan who are working in the same areas as well. So in Sri Lanka, we have been doing this work for the past decade or so, probably over that. So there are a lot of, in the team, there are a lot of young scientists as well as mid-career researchers who are involved in this work. And through this research program, we have been able to improve the infrastructure in the laboratory, as well as we have developed the field sites. So there are frequent field visits that are being done to collect the vectors and do the studies in the laboratory. So there's a lot of work that's going on with a fairly big team of ours.
Yeah, that's cool. And I think my first time hearing about leishmaniasis was when I was in Colombia. And, typically tropical diseases are not discussed as much until I think the last decade or so. That's when it has sort of become so popular. So it's good that you are all working on diseases that are important and are saving lives. And what about you, Rashad?
Thank you very much. I'm pleased to join this conversation. I'm now working on a project related to public health to assess COVID-19 vaccine hesitancy and its predictors among healthcare providers in Sana'a here in Yemen. It has been specifically designed to determine the proportion of COVID-19 vaccine hesitants and to identify the reasons and predictors of such hesitancy among them. In fact, I mentored and I'm still mentoring undergraduate students of medical laboratory sciences in completing their graduation projects. Meanwhile, I served as a supervisor for postgraduate master's and doctoral students internally at the Faculty of Medicine and Health Sciences in Sana'a University and externally in collaboration with Alexandria University in Egypt. I mentored research teams as part of my role as a principal investigator or co-investigator for a number of TDR-funded projects in underserved communities in Yemen. In fact, funding by TDR helped me too much to grow my research network. As a researcher from a resource-limited country, this funding represents a turning point in my academic and professional life. I received my first fund in 2014, soon after receiving my PhD. I published many publications in peer-reviewed journals for the findings of these research studies with open accessibility. A major stride in my research was in 2017 when I have been selected as a principal investigator for drafting a TDR funding commissioned review about the consequences of people displacement on vector-borne disease transmission in collaboration with researchers from developing and developed countries. And this pushed me from local to global perspective. I'm also working on some projects on malaria in collaboration with research teams from endemic areas in Yemen. One of the most interesting mentoring activities I took part in through TDR Global was the mentoring of a TDR Global mentee from the Kano state of Nigeria. Who had been selected for crowdfunding after winning a TDR Global Challenge contest for capacity building. His research was about community-based interventions to prevent and control urogenital schistosomiasis. In fact, it has been a long journey of online contact via email and WhatsApp since 2019, I guess.
This is so impressive. You're all doing such great things, and they are all connected, but in sort of different ways. For example, not just looking at the disease itself, but the social determinants, working on sort of current issues with COVID and the hesitancies associated with it. Just to transition on from the work that you do, for example, Rashad talked about how receiving a grant from TDR was sort of the turning point that sort of he got the funding, so he was able to do the work that he did, and then that sort of created like new opportunities into other fields of study or other research. My question is, since you work on research on different infectious diseases, including neglected tropical diseases, that does not often receive sort of whether it's attention or research until recently, what difficulties have you encountered? And this is not just related in your work, so it could be a part of it. What difficulties have you encountered and how have you overcome them? So maybe we can start with Nadira.
Thanks, Ella. Actually, being a developing country, we have the same sort of limitations like any other developing country. Doing research, you need a lot of resources. Obtaining those resources are always a challenge. So unless you have a grant, it's very difficult to conduct research in this, in whatever the area that you want to perform. So I did my PhD with TDR funding, and that really produces sort of a solid foundation to build on. To make it even better, I got a postdoctoral award from TDR, which enabled me to get training at the University of Edinburgh, UK. And I was able to spend 2 years there at that university, which enabled me to get the required skills and competencies in progressing or moving forward with my career plans. Actually, afterwards, I was involved in this pathogenesis and applied genomics steering committee, which really gave me a lot of confidence and helped me to build the sort of expand my career and build my research team. So it was an enormous help being in this amazing group of established scientists in this steering committee.
Thank you. And that's really cool. Sort of overcoming the limitations, whether it's sort of an opportunity you got from receiving grants from TDR, and I'm sure maybe Rashad and Gustavo can elaborate on it. So limitations with funding, but also just accessing the skill sets that one might need to do the kind of work they do. And we've done a previous episode on confidence related to like imposter syndrome, which I'm experiencing still, working on it. And so sort of other challenges that might be physical or like monetary, but even ones that are internal that might not be so obvious. Rashad, if you could tell us about some challenges you faced in your work and your research, and maybe some ways in which you've overcome them.
I agree with Nadira with all what has been mentioned. In fact, difficulties and challenges I faced during my mentorship are diverse, depending on the particular project and mentee conditions as well. However, I think one of the most important and most frequent challenge is how to keep good mentoring in the context of work overload, teaching activities, and the limited time availability, particularly when I have many mentees with different research topics. Another challenge, in fact, is that the mentees here in Yemen lack research methodology background, academic writing, and statistical skills. And this poses another challenge to the mentor. In general, in Yemen, low technicality is one of the major challenges we are facing. in order to perform projects involving molecular methods or something like that. These are the main challenges I'm facing here in Yemen. Thank you.
Thank you too. And Gustavo?
One of the difficulties encountered at the time of starting my career in public health was that despite having theoretical knowledge, I did not have enough field experience. So I compensated for that weakness by associating myself with senior researchers, ex-TDR grantees, to learn from them and absorb that experience. It allowed me in a short time to lead my own investigation. Another challenge that I faced was the weak interest of the authorities in health research to generate evidence and inform decision-making. This required obtaining the support of consultants from the Pan American Health Organization to capture the interest of the authorities in this research. Finally, I can say the motivation of local staff to introduce changes in the delivery of health or education services, as has been the case in the implementation of a school program for the control of Aedes aegypti. And for this, the accompaniment of teachers in the classroom setting was instrumental during the implementation of school courses.
Thank you. Thank you all, Nadira, Rashad, and Gustavo, sort of sharing challenges you face, whether it's with a lack of skill set, whether it's research or, like, for example, as Rashad talked about, statistical with the student, or lack of field experience, collaborating with others, going outside of your country to sort of acquire those skills and come back. Those are some of the challenges that these great men and women have faced, and some ways in which they've overcome them. And then I guess we can transition into talking about relationships, because in many of sort of the points you brought up about the challenges you faced and the ways in which you overcome them, you talked about, for example, having associations or with others who have the skill sets, or even going out or collaborating with like other researchers and learning from them. So can you tell us about how you first sort of maybe established these relationships and how you've nurtured them, but also maintained them over the course of your career? And we can start with Rashad.
Thank you very much. Actually, as a mentor, I used to explore the motives that might influence the outcomes desired to be achieved by my mentees. Encouragement and providing mentees with constructive insights and specific instructions enabled me to motivate them to keep moving forward despite hurdles and challenges I mentioned earlier. Of utmost importance to maintain my relationships with mentees were dedication and commitment, effective communication, timely feedback, and punctual mentoring appointments. These are very important core values in order to maintain a good relationship with mentees. Also, seeking to identify the strengths of my mentees helped me to boost their confidence in a manner that helps them perform tasks and achieve goals. I used to discuss the ideas raised by mentees and hence to provide them with the necessary advice and comments based on my knowledge and experience. Meanwhile, I'm also keen to listen carefully to the challenges they were facing during their work and suggest appropriate solutions to such problems. Such approaches were helpful in building and growing the trust between me and my mentees.
Thank you. So, Rashad, you've talked about how you maintain and sort of strengthen your relationships with your mentees. What about you, Gustavo? For you, maybe on the flip side, how have you, or how did you establish, maybe you still do now, relationships with mentors, so people who mentored you? How did you establish relationships with them, and how have you been able to maintain those relationships?
In my personal experience has been through regular communication and technical exchange on the research carried out with other investigators, through critical review of research works to learn the points of view of other researchers, and finally, to exchanging with research groups from other countries working on the same area of interest to share experiences and establish strategic alliances. I particularly remember the collaboration established with the group of Dr. Ángel Betanzos of the National Institute of Public Health of Mexico for the review of a school content on arboviruses. The final product was the elaboration of a school course on arboviruses. I consider this is the first school content on the 3 arboviruses because the previous one had been exclusively on dengue topic.
Thank you. And Nadira, could you tell us maybe, I don't know, on both ends, so you could be a mentor or a mentee yourself, so a mentor towards others and a mentee for another. Could you tell us sort of how you navigate maybe sort of both sides of relationships and how you sort of maintain them and nurture them?
Thank you, Ella. If I may start with my own experience, I joined the university as a probationary lecturer, and I was so keen of becoming a scientist because I felt it is an important part of academic life. So I was very fortunate when I joined to find a very successful researcher who was willing to take me under her wings and nurture me through these early years. Even now, you will be surprised that I reach out to her, especially when the going gets tough, particularly. So I think the mentoring that I received left a sort of a permanent imprint on me, and that has made me crave to develop myself as a researcher and build a research team, inculcate those research culture that I learned among these team members, and also build and expand the physical infrastructure which we really need to carry out research. So I try to reach out to young scientists and young academics to help out with their training, to help with their career development, because I take pleasure in watching my trainees grow and succeed in their own careers. So it has been very encouraging to watch them. And I tell them when they ask, sometimes when they are so overwhelmed, they ask, I don't know how to thank you. Then I say, you can do the same thing to the younger generation. That's the way to thank me. And I always encourage them to apply for research grants. And I act as co-PIs to give them the confidence of conducting those research programs. And when they are ready, I co-supervise trainees with them so that they can grow and learn from experience. And also we talk frequently about work-life balance, which is also important, with a family life. I have 2 daughters as well. So balancing those career with the family responsibilities becomes very important.
Thank you. And I think you actually answered my following question. So this is good. It offers like a perfect segue. And feel free to chip in maybe if you want to talk exactly about sort of how you structured your mentoring program or sort of like the initiation. You can add a Nadira. But this provides a perfect segue. So maybe we can start with Gustavo. How are you passing on your skill set and your knowledge towards others, since we're your digital mentor podcast? Maybe if you could tell us the different ways you are passing on all the experiences and skill sets you have.
Yeah. Throughout my career, there have been various modalities that I have adopted to transfer my skill to other work teams. And one that I have enjoyed the most is when I was member of the editorial board of the Honduran Medical Journal for a decade. This position allowed me to interact with young researchers and others researchers in the development of their career and to help them to improve the manuscript they submitted for publication to the Honduran Medical Journal. Direct communication was established with the research team, and they were pointed out the aspect to be corrected in their manuscript so that they could reach the quality required to be published in the journal. Likewise, we developed medical writing courses at a national level that allow us to transfer knowledge to future researchers on how to prepare their manuscript and to review the methodology with them of the proposed research and guide them based on the personal experience I developed as an ex-TDR grantee. At another time, I was professor at the School of Medicine of the Catholic University of Honduras, and through the lecture, I share my experience in public health and introduce these medical students to the fascinating field of preventive medicine. Recently, It was a great satisfaction to know that one of them is now a national advisor within the PAHO office in Honduras. Finally, I have promoted the interest of various young professionals to continue their postgraduate studies outside the country and to take advantage of the training opportunities that exist, given that I myself was favored to carry out postgraduate studies abroad through the Rockefeller Foundation in the US, the Carolina Foundation in Spain, and the scholarship received from the Gorgas Clinical Course in Tropical Medicine in Peru. My job has been to mentor them on how to prepare their application to a scholarship institution, the review of thesis proposal and motivation letter. And in this year, we have a microbiology professional from Honduras, Katia Lopez, as part of the 4th cohort of TDR scholarship holder of the master program in epidemiology, which takes place in Medellin, Colombia. Currently, I am motivating other professionals from the Dominican Republic, Nicaragua, and Honduras to apply to the 5th edition of the epidemiology program for the year 2023. I am passionate about promoting young professionals in the area of public health, and I believe that my experience and knowledge can help these young people fulfill their dreams and become, in the medium term, part of the next generation of high-level public health professionals in their countries.
This is really great. Whether it's I recently actually wrote a paper on like knowledge production and how it's there's not a lot of knowledge production that is coming out from low and middle income countries with respect to the rest of the world. So working with others to ensure that they're able to sort of get their work and manuscripts published, allowing them, working with them to get scholarships to go out, get a skill set, and hopefully return back to their country to implement the work. Yeah, so these are all great. And so Nadira, I maybe I might have missed it. You said you also help with the construction of infrastructure, like buildings, to help facilitate mentoring. Was that it?
It's more than buildings. We have buildings, but the equipping the building space, adding equipment, the required physical infrastructure to build laboratories becomes really, really important, because having the, facilities, laboratory facilities, field facilities for research, particularly when people, scientists go out, get trained in established laboratories, they find it difficult to come back and adapt because the resources that are available are so limited. So my intention was to build the infrastructure so that people who get trained can come back and establish themselves. Yes.
Yeah, and I think that's a cool, for example, like Gustavo is like working with like them to like improve their skill sets, get the opportunity to go outside of the country, publish their manuscripts. And sort of another flip side of mentoring that I wouldn't have thought about is sort of creating the space that is conducive and allowing them to sort of practice those skill sets and grow them. And so thank you. And then Rashad, how do you pass on this knowledge and skill sets that you've acquired towards others? It could be in research or even beyond that.
I think it is so important to pass the mentor skills to mentees. By playing a positive role model through words and actions, not just by words, but also by actions. I struggle to pass down my skills in research methods, scientific writing, and statistical analysis to my mentees through guidance, constructive feedback, and comments. I try to adopt constructive criticism in a tactful way that helps mentees without breaking their self-confidence. I also share with them my past mistakes, shortcomings, and experiences that happened to me in similar situations. I think that passing on critical thinking skills to mentees is one of the most important issues to be considered by the mentor. The mentees should be able to discuss and defend their perspectives and should be able to make appropriate decisions on the challenges they face. One of the things I try to pass to my mentees is how to prepare, write, and submit their manuscripts for publication in index journal. I think that the mentor should stay connected with the mentees even after finishing their projects. Thank you very much.
Thank you too. You're all doing such great work. Just a recap, sort of, I think I find it cool that you're all working on different assets and sort of connected, but in different ways. For example, allowing others to get the opportunity and the resources to get the skill set, or even helping them acquire the critical thinking skills to appropriately they themselves face the challenges they have to face, or in addition to sort of helping them face the challenges within the time, but also providing them with a space they can practice skill set. I think those are really cool ways to think about passing on knowledge and skill sets towards the next generation.
Yes, I agree. Temporal relationships with mentees is of utmost important, because this also widens the research networking of the mentor.
Yes, networking. Yeah. Yeah, thank you. And as we come to an end, I wanted to ask if you had any advice. I know, Rashad, talked about sharing your mistakes with your mentors so they can also learn from that and sort of apply it. But overall, do you have any advice or lessons that you want to share with our listeners with regards to working in infectious diseases of poverty, or just in your general work? Because you've been working a lot, whether it's with COVID, building lab buildings and others as such. Do you have any advice for our audience? We can start with Rashad.
My advice is to keep moving forward in research on infectious diseases by preparing good proposals for funding, by good implementation of research projects, and most importantly, to publish the findings of such studies in open access journals in order to be accessible to anyone in the world, particularly in developing countries.
And Gustavo?
My advice in this particular era of coronavirus is to maintain communication with other advisors, especially from the local offices of WHO in their countries, in order to know the opportunities to obtain training educations or training in the country or training outside the country, and also how to other possibilities in order to develop my skill and abilities, for prepare, as Rashad said, to prepare good proposal in order to obtain funds from TDR or other donor agencies, because in this particular time, the resources are difficult to get because the pandemic is getting the funds from the Ministry of Health. And so establish this relationship, a connection with advisor from this institution can help us to prepare good proposal in order to obtain support. Yeah.
Thank you. And Nadira?
My advice would be to be focused and be determined, because when you work in a developing country, there will be challenges. There will be numerous challenges that you would need to deal with and overcome. But if you have set a goal and if you are determined to get there, you will find a way to do it. So you can do it. So be focused and be determined. That's my advice.
Audience, you've heard it. Be focused and determined. Find ways to tap into the resources that might be within your local community or even outside, and keep moving forward. That is the advice from our three guests. And I want to say thank you very much for joining us today and for sharing your stories, your experiences and knowledge with our audience. We are grateful to have you, and I hope that you continue to do the great work that you do, and to maybe meet you in person. But thank you very much.
Thank you, Ella.
Thank you to you all. Thank you very much.
Could you please tell our listeners where they can find you? Gustavo?
Okay, I work in the University of the Valley of Guatemala. The university has a website, University of Valley of Guatemala. Also, they can reach me at my institutional email. We have a web page that I can send you the site, where they can reach information about our program in Central America.
Yes, and we'll add that in our description box. And what about you, Rashad? How can our audience find you?
In fact, the easiest way is to search for my name. I have a TDR global profile, and all my contact information, including my phone number, my emails, are on my page in TDR global profile.
And Nadira?
I am from Faculty of Medicine, University of Colombo, Sri Lanka. And easiest way to contact me would be through email. and also LinkedIn.
So thank you. So you've heard from how you can reach our listeners, and we'll provide their contact details and links to their website in the description box. And for our listeners, thanks for tuning in. Please follow us on Twitter at mentor_podcast. Again, mentor_podcast, where we'll let you know when new episodes are released. You can listen to us on YouTube, Spotify, Apple Podcasts, Google Podcasts, SoundCloud by searching Your Digital Mentor Podcast. You can also reach us by email. So please send your comments and questions to inquiries@yourdigimentor.net. Again, inquiries@yourdigimentor.net. As always, information on the episode and how to reach us will be in the description box, including how to connect with our guests and also links to more information and resources. And finally, our goal is for this podcast to be shared as a resource. So please remember to tell people about us. Thank you and see you again in a few weeks.
This episode is supported by Advanced Courses and Scientific Conferences, a program which develops and delivers training and conferences that span basic research, cutting-edge biomedicine, and application of genomics in healthcare. Through engaging and networking, the events educate, inspire, and transform careers worldwide.
This episode is also supported by the Wellcome Sanger Institute. It undertakes large-scale research that forms the foundations of knowledge in biology and medicine. It uses the power of genome sequencing to understand and harness the information in DNA. The Sanger's discoveries are used to improve health and to understand life on Earth.